currently we're caring for about 75 COVID inpatients across our hospital system. This is a combination of positive patients and patients who are still recovering from COVID. We currently have one COVID patient on a ventilator, which is good news. That's the lowest number of patients with COVID that we've had in the hospital in several months. Most patients that are being admitted are unvaccinated or under-vaccinated, meaning they did not complete their primary vaccine series or they haven't received the recommended booster dose. And they're often older patients, generally 65 years of age and older. There is a new COVID booster now available that's directed toward new types of COVID variants as well as the original COVID. This is called the bivalent booster. If you've not yet received the bivalent booster and you are eligible to get it, it's recommended you do so soon, especially as we head into the colder months when we expect COVID numbers to increase again. We encourage the public to talk to their physicians about whether the new COVID boosters are right for them. You may have seen reports about new subvariants that have emerged across the globe, including in the United States. The dominant strains of COVID currently in the United States are BA.5 and BA.4.6. There are additional mutated versions of Omicron like BA.275 and BF7 and BQ1 out there. There's also XBB. This is kind of referred to as the Scrabble or alphabet soup versions of COVID. These variants are very contagious, but we don't have a lot of indication right now that they're more serious in terms of the disease they cause. And while the variants may not cause more severe disease, the current monoclonal antibodies we have will no longer work against many of those newer variants. Oral medications for COVID like Paxlovid should still be effective. So because there'll be fewer tools to treat people with COVID disease, it's really imperative that those at high risk consider making sure their vaccination series is up to date. We know in the past that COVID cases have trended upwards in the wintertime, and we will likely see a similar trend this year. At this point, most of us have either had COVID and so we have some natural immunity, or we've been vaccinated, or both. If that's the case, it's important to remember that protection from COVID-19 through vaccination or natural infection, it fades over time. So as we head into the winter and the respiratory virus season, we should be thinking about our own personal risk and how we can protect ourselves. And that might mean getting a booster if you've not already done so, consider wearing a mask in crowded areas, and of course, staying home if you're not feeling well. And as we've said many times, the entire pandemic, it's important for people to gauge their own risk based on their age and what medical issues they may have, as well as their vaccination status and whether they've had COVID and when. Many people might be wondering when the best time to get boosted is as we head into the holiday season. Remember, protection from vaccine starts about 2 weeks after you get that dose. So with Thanksgiving coming up, it's probably best to get boosted within the next 2 weeks.